I'm Dr. Sharjeel and you're watching my YouTube channel. If you like my videos, don't forget to subscribe my channel. Now today's topic is Hirschberg test. It is also known as corneal reflection test or corneal light reflex test. Now it is one of the most important ocular examinations, a quick and simple method to evaluate misalignment of the eyes. Now how to perform this test? Well, examiner should be at the level of the patient. He will first greet the patient, introduce himself, explain the procedure to the patient, and ask permission, and then start. Like, hello, how are you? I am Dr. Sharjeel and I would like to examine your eyes with a pen torch. If the light is bright and uncomfortable, please let me know and I'll stop the examination. Should I proceed? And after consent, keep the pen torch 2 to 3 feet from the patient's face. Direct the beam of light in between the two eyes at the nasal bridge. Ask the patient to look into the light source and observe the light reflex on both corneas. If the reflex is in the center of the corneas and pupil or slightly decentered nasally, it is considered Hirschberg test negative or normal. Like for normal alignment, reflection will appear in same position in each pupil. If it is not in the center of the pupil, you should suspect strabismus, and then the reflex will be off-centered, either near the pupillary margin or at the pupil margin or on cornea above the iris, in the middle of the iris, near or on the corneal limbus, or even on the sclera in extreme strabismus. Hirschberg is estimated in degrees or prism diopter. 1 degree is equal to 2 prism diopters. If the reflex is at the center of the pupil, there is 0 degrees and the corneal reflection test is negative. And if there is a deviation, like it is at the pupillary margin or away, then the Hirschberg test is positive, and the deviation is roughly near 15 degrees or 30 prism diopters. If reflex is at the center of the iris, it is approximately 30 degrees or 60 prism diopters, and if corneal reflection of the torch is at limbus, it is 45 degrees deviation. Severe squint or strabismus. For every 1 millimeter of deviation from the center of the pupil, it will take 15 diopters of prism to correct that misalignment. Like 2 millimeter off center means 30 prism diopters, and 4 millimeter means 60 prism diopters or 30 degrees. Now, Hirschberg not only tells you crudely the amount of deviation, but also tells you the direction of the squint. Like if the light reflex is off-centered on outside or lateral cornea in front of the iris or on lateral limbus, it means the patient globe is moved inwards and the patient is having esotropia in that particular eye. And if the reflection is on the inside of the eye towards medial limbus, then the patient is having exotropia. If the light reflex is towards the inferior limbus, it is hypertropia, and if the light reflex is near superior limbus, it is hypotropia. So the reflection will be opposite to the direction of the squint. So that's a quick crude method of quantifying misalignment of the eyes or measuring the amount of deviation. And when Hirschberg test is positive, then you go towards the more accurate tests like cover and cover and prism cover tests that tell you exactly how much the deviation is. So that was all about the Hirschberg test, and now I would like to show you the real cases, starting with the Hirschberg's negative. Like this patient, this was a student on which I performed the Hirschberg test, and you can see the white reflection in the center of the corneas, in the center of the pupil, and both eyes have got central corneal reflection. So Hirschberg test was negative. Now in the second patient, if you can see that the corneal reflection is central in the left eye, whereas it is mild off centered in the right eye. So it is 5 to 10 degrees of exotropia in the right eye in this child, a very mild right exotropia. Now in the third patient, again the left eye is centered, the Hirschberg test, whereas in the right eye again you can see that the reflection, but here the reflection is at the pupil margin. So we have already discussed that even the reflection is at the pupil margin on the inner side, so the patient is having right exotropia, and at the pupil margin 15 degrees or 30 prism diopter, and there is a bit element of the reflex is little bit superior, so there is a little bit hypotropia as well. And in this patient, the deviating eye is left, and the corneal reflection is at pupillary margin, and again there is little bit vertical misalignment as well. The globe is little bit upward with inferior oblique overvection. And now the deviation is little bit more. The right eye is centered, Hirschberg corneal reflection, whereas in the left eye the reflection is in the center of the iris. So there is exotropia, and it is almost 30 to 35 degrees, and after correction you can see that now the Hirschberg is negative in the left eye, and I have fully corrected this patient's 30 to 35 degrees exotropia. And now in the last case, the extreme squint, again right exotropia, and you can see that the corneal reflection is at the limbus, so it is 40 to 45 degrees right exotropia. Thank you very much.